1.3 Fiber optic endoscopy. Let's begin. Look inside our body. These are pictures taken by endoscopes. They show an esophagus and a duodenum. A fiber optic endoscope makes use of the physics of light when light travels along optical fibers. 1. The endoscope, a tool for medical imaging. Fiber optic endoscopy is a non-invasive diagnosis procedure. The endoscope is a thin, flexible tube with different channels for optical fibers, and even tools like forceps to be inserted into the patient's body. Doctors may examine the inside of the hollow organs just by inserting an endoscope through an opening of the body, such as the mouth, nose, anus, and so on. Doctors may also examine the outside of an internal organ by inserting an endoscope through a small hole cut in the skin, which is of course an invasive procedure. 2. Characteristics of optical fibers. Light transmits through an optical fiber by successive total internal reflections, which was the idea proposed by Dr. Charles Cole in 1960s. Since then, Dr. Cole was known as the father of fiber optics. A. Total internal reflection. A brief review. You have learned that light travels through an optical fiber by successive total internal reflections. So, what's more? Cladding is the layer that surrounds the central core. The refractive index of cladding is slightly smaller than the core, so that total internal reflection may occur. The cladding enhances total internal reflection, and it also gives strength to the fiber, so as to protect the core against damage and dirt, and also the leakage of light signal when two fibers touch each other. Example 6. Refractive index of an optical fiber cladding. The refractive index of cladding must be larger than 1, of course, but smaller than that of the core. It is better if it has a lower refractive index to reduce chances of light leakage. The maximum refractive index of the cladding is given by the equation eta 2 equals eta 1 sin C. B. Coherent and incoherent bundle fibers. Bundle fibers consist of many fibers bundled together into one. Due to slight difference in manufacturing process, there are two types of bundle fibers. 1. The coherent bundle fibers. The word coherent here does not mean same phase difference. A coherent bundle fiber preserves the relative position of each fiber from one end to another. 2. The incoherent bundle fiber. An incoherent bundle fiber has fibers randomly arranged. Their relative positions are not preserved. Obviously, it is more difficult to manufacture the coherent bundle, and so it is more expensive. In an endoscope, an incoherent bundle fiber is used for illumination, and therefore transmits the light from a light source to inside of a patient's body. Then a coherent bundle is used for capturing and transmitting the image of the inside structure of the patient's body to the doctor for examination. Do check point 6 below.